Now, is this a good-looking spine or is this a good-looking spine?
This is a pretty good-looking one, and I'll show you some bad-looking ones in just a few minutes.
Now, tell me, what is the difference between a good-looking spine, we're going to pull this one up here as well, and a bad-looking spine? And she's a chiropractor, by the way. She knows what she's talking about.
Yes, I've been a doctor of chiropractic since 1989, so I've got lots of years of experience.
You sure do. Wonderful.
Okay. Now, one of the reasons I want you to know, the reason that I came here is because you were telling me last week that you were having some back problems.
I have been having some back pain, you know?
Yes.
It hurts and it's pretty
I'm here to talk to you a little bit about it and how chiropractic can help you with that problem.
Perfect.
Now, first of all, there's some normal curves that should be occurring in the spine.
Okay, so you don't want a straight spine.
Well, it should be straight when you're looking at it front on, like this.
Okay. Whereas this one is looking a little crooked.
But it should be having normal curves. So when people talk about I have a curvature of the spine, that's actually a normal thing.
Gotcha.
So you have to speak of a scoliosis as an abnormal curvature of the spine. You have to use that word.
Gotcha.
That's something that's not regular. So you should have a curve in right here.
I see.
An inward curve. Then you should have an outward curve. Then you should have an inward curve. So this is
doing
actually,
all kinds of dancing.
Yes, this is a curve that actually occurs to enable a child to walk. Have you noticed that infants and small children that can't walk have a straight spine? Have you noticed their back is straight here?
Can't say I've noticed that.
Okay. Well, if you ever have noticed that their backs are straight, it's because they can't walk. But as they begin to walk, this curve comes here to allow them to be able to walk and balance their hips.
Okay. So now, back pain. People who say, you know, I need to crack my back. How does that come into a straight spine, or does it?
I tell people all the time, if you had something going on with your teeth, you wouldn't try to do it yourself.
No. No, I would not.
So what happens is, you know, all these types of things need to be done by trained professionals.
Sure.
Now, actually, what you were talking about, what you described, I actually say is okay.
So just kind of cracking your back,
because actually what you're doing is putting some action and some motion, and the truth is, if you don't use it, you lose it. That's the God's heaven truth.
Okay.
So the fact that what you were doing was actually okay.
Twisting.
Yeah, she was telling me that she was twisting. That's fine.
Okay.
But as far as if you ever took your own, watch this, if you ever took your own face and tried to do something like this with it, that's out.
So that's when you see people cracking your back.
Or if you ever took your own back and tried to do something like that's out, because there are actually certain angles, as you may see. This was not just 2 years. This is 6 years of study here that let me know how these different bones fit together perfectly.
Oh, wow.
So you actually have to use them. People ask me all the time, is it about strength? I said, no, it's about leverage. Chiropractic is really physics. It's an art and it's a science and it's a philosophy.
I'm in trouble then.
Right. So you have to actually use your hand in a certain direction to move them.
Okay. Well, this is also fascinating. So you can crack your back if you're just kind of stretching, getting out those minor things, but don't do one of these.
Right. That's exactly right, because there are certain angles in which they move. So if you've not been trained in the right angle, then you don't know. You actually hurt yourself.
Now, what would happen if, say...
And please, I'm interrupting you. Please don't let anybody walk on your back, Kelly.
Okay, good to know, good to know. Now, what would happen if someone did walk on my back?
I called you Kelly. I just remember his Melanie.
That's all right.
Right.
That's
I looked over there and said,
we're just all so excited. So we're going to find out much more about what would happen, maybe the proper ways to do it, and the difference between proper back cracking, I guess chiropractic, what's it called? Adjustments, and maybe massage therapy, because they both can be very useful. Kelly, first over to you.